Okay. Hello, everyone. Welcome to the November monthly meeting for the United Spinal Association Northeast Ohio chapter. I am going to skip all announcements and just kind of get right into it. It's kind of the same announcements as before. So if you've not received a emergency prep kit, which is very fitting for this evening's presentation. Email us if you are interested in peer mentoring or connecting with a peer. Email us, let us know. We'll do our best to help with everything. So tonight we have Maria Sutter with us. We have done this presentation, a similar presentation before on emergency preparedness, but it's always great to have a refresher. We're heading into the winter months. So things to think about before all of the snow hits, since we got our first glimpse yesterday, if you were in the lucky parts. So Maria, welcome. Thank you. And take it away.
Got it. Okay. Yeah. Thank you very much, Megan. And thank you guys for spending the next 50 or so minutes listening to me talk. My name is Maria Sutter, as Megan has said, and I am the peer support specialist at LEAP, which is an independent living center, one of the independent living centers up here in the Cleveland area. I'm going to go ahead and share my screen and launch this. And hopefully you're all seeing the beginning slide here with the intro to what we like to call Survive and Thrive, emergency preparedness for people with disabilities.
Yes, we see it.
Great. So just real quick to start off, who is LEAP? As I said, we are one of the independent living centers up in Cleveland. LEAP stands for Linking Employment, Abilities, and Potential. We are, as our mission statement says, an agent of positive change, working to advance participation and equality in society for people with disabilities in Northeast Ohio. So we actually serve 5 counties in Northeast Ohio: Geauga, Cuyahoga, Lake, Medina, and Lorraine. We provide a variety of services, but we really try to focus on helping people live independently with independent living skills training, public transportation, peer support, personal assistance. We provide nursing home transition through a program called Home Choice. We assist with employment, so both people who are adults getting back to work or who may have not worked and are interested in working, to youth and student services. One of the biggest things we do is benefits assistance. So we can help you determine if you're getting the benefits you need. If you're not, we can help you enroll, can help you find what other benefits might be out there that you don't know that you qualify for. And then we do some outreach and training in the community. So we try to do stuff like this where we reach out to different groups that reach out to people with disabilities. We also try to do employer training things, classes, workshops. We provide a recreation program that has in the past been mostly geared toward people with developmental disabilities, but we are starting to rework our recreation program, hopefully to open it up. It's been challenging during this virtual world, but that is not to say, we don't have people trying to think out of the box. And then We try to work on advocacy with workforce innovation, and we also try to address adaptive technology. Just a few things to keep in mind if you're not familiar with us, and if you ever think of any of these services and need help with them, we could be your source. Okay, so to get to what we're talking about this evening, we are going to look at this as kind of a disaster planning quick guide. So I'm going to try to increase some awareness. We're going to touch on some COVID-19 stuff. We're going to talk about disaster prep strategies, stuff from building your personal support network to creating a financial first aid kit. We're going to look at how you should assess your needs and capabilities, and then how to create your individual disaster plan and what to consider when you're considering your emergency kits. Okay, so understanding disasters by increasing awareness. So the first thing we want to kind of cover as an overview is the idea of types of disasters. So generally you have like 3 types of disasters. The natural disaster, which would be your weather disasters. And we're pretty familiar with a bunch of them here in Northeastern Ohio with snow, flooding, tornadoes. And then, you know, in different parts of the country, they deal with more hurricanes. We deal with some earthquakes here. More tornadoes if you go west and south than we deal with. But also in the natural disaster realm would be health related. So the pandemic that we've dealt with now for almost 2 years falls under what would be considered a natural disaster. And then your technological disasters, those are going to be things like power outages, gas leaks, stuff like that. And then man-made disasters are more things like terrorist threats or bomb threats or things of that nature. Then one thing just to remember, especially as we're going into the snow season, you have this watch warning thing that you hear about all the time when they're announcing like a thunderstorm watch or a snowstorm watch or a warning. And basically, if you just remember that the watch is telling you to be prepared and a warning is telling you to take action, it's a good way to distinguish the watch being the less severe and the warning to be more severe. So I thought we'd touch on a few things COVID related. I know we've heard about it for months and months and months now, but it's good to remind yourself where things stand. So, you know, the COVID-19 is still spreading. If you are keeping up on current events, you'll know that in Europe, there is what seems to be another wave happening there. And they're saying that, you know, the US should be braced because what hits in Europe kind of follows here. And as we know, the spread is mainly person to person. It's by breathing in small droplets and particulates that have the virus when an infected person exhales. You get these infected droplets landing on your eyes, your nose, your mouth, transmitted mostly through coughs and sneezes, but it can just be through talking, and then touching your eyes or nose or mouth with your hands that might have the virus on them can also spread it. So you can, if you're standing closer than 6 feet to an infected person, that's the most likely kind of range that you could get these droplets on you. And it is important to remember that anyone who's infected can spread it. People can be infected and have no symptoms. People can, unfortunately, though it is not as common, can have gotten vaccinated and can get infected and can still spread it. So prevention. Obviously, the best prevention, according to the CDC, is to get fully vaccinated. And, if you are 18 years or older, you can get any vaccine from any manufacturer. If you are 5 to 17, only Pfizer has an approved vaccine for anyone in that age category. And then on top of being fully vaccinated, which for Pfizer and the Moderna vaccine is a 2-shot regimen, for Johnson & Johnson is just 1. We are now being encouraged to receive a booster shot. So if you got Pfizer or Moderna, and you've had both shots, then at least 6 months after your second shot, you can get the booster. They are recommending it if you're 65 or older, or if you are 18 or older and you live and work in like a long-term care facility or a high-risk setting like a hospital, places where there might be an influx of people who might not be vaccinated, so different parts of the country, or if you have underlying medical conditions. So that would include people with spinal cord injuries, although I know when the vaccines first came out, it was harder for people with spinal cord injuries to get vaccinated right away. Now with the booster, it's much more open. If you sign up and go, they're gonna give you the booster. If you've had the Johnson & Johnson vaccine, you apparently only have to wait 2 months after your vaccine for a booster. And then Johnson & Johnson only requires you to be 18 or older. There aren't any other qualifications they're requiring. And then related to which booster shot you should get, the literature out there is, it varies apparently. At first I was under the impression that if you got the Pfizer vaccine, you should get the Pfizer booster, but that is not necessarily the tried and true literature out there. So if you are looking to get a booster shot, I would probably consult your physician first to find out what they recommend and then proceed from there. It is still recommended to wear masks if you're not fully vaccinated, and if you're under 2 years old, or if you have someone in your family who is under 2, you may want to keep masks around them, keep masks around anyone who hasn't been vaccinated. If you have a condition or you take medication that weakens your immune system, and it is required on planes, buses, trains, other public transit, you should still try to maintain that 6 feet of distance. If you're in your house and there's someone who has COVID, definitely someone who might be sick and you're not sure if it could be COVID, for sure. Outside your home, anyone who's not a family member, it's still recommended to maintain that distance. The CDC still recommends avoiding crowds, especially poorly ventilated indoor spaces. Hand washing is still recommended. And using hand sanitizer if you don't have soap and water, and then cleaning and disinfecting regularly. Symptoms, I felt for a long time the symptoms list kept growing and growing and growing, but it seems the symptoms list is pretty consistent now. If you're experiencing fever, chills, cough, shortness of breath, fatigue, body aches and headaches, a new loss of taste or smell. So if you have had a decrease or already had a loss of taste or smell, it's probably not a symptom. Congestion, runny nose, sore throat, nausea, vomiting, diarrhea. I know vomiting was a bigger symptom that was seen with the Delta variant. So it really can run the gamut. So if you feel under the weather and it doesn't seem to be getting better, whether you've been vaccinated or not, it's always a good idea to get a COVID test. Those are now a little more readily available because you can find them at some of your pharmacies. Walgreens, CVS around here has them. And if you feel sick, just like any other sickness, stay home, stay away from others, wear masks, and like I said, get tested. If you are looking for information on COVID-19 and resources, the CDC, they have tons of information. The World Health Organization, your state and city health departments. And then there are some good mutual aid resources and like coronavirus toolkits and stuff you can access online. And all these links will be, I can provide the PowerPoint. So if anyone wants an actual, PDF copy or the PowerPoint version, you can get that, and these links will be in there. So now for the more overall broader disaster prep. So there are some pre-planning strategies that it's always good to consider. And the first I like to call research your resources. So you want to have on hand kind of some go-to national resources. And a lot of these you can find in the form of apps. Your 211 is a number you can call pretty much in any area of this country, and that will connect you to local contact, like call center, that will be able to provide you with information about, not just disaster prep stuff, but anything really. So if you're trying to find the number of the health department, or if you're trying to find the closest urgent care, or if you're trying to locate shelters in your area, 211 will be able to connect you with that. Then there are national resources like FEMA and the National Red Cross, both which have apps you can download on your phone. And these are great because they help connect you with national resources as well as local resources. So if you're in a situation where maybe there's a major power outage in your area, there's not going to be power for a week and you need to go to a shelter, these kinds of resources are good to have on hand because they can help connect you with local shelters. And then local resources, you should know your state and county Office of Emergency Management and your health department. It's good to know the direct numbers to your local fire department, your preferred hospital, your urgent care. Save these in your phone, but also it's not a bad idea to have a hard copy printed out and put in your emergency kit. Phones go dead. Hopefully hard copies, if you put it in a Ziploc bag, can stay dry. If you have pets or service animals, you should also have information about an emergency vet. So once you've done some research, you should always decide where you're going to go. You should know like a close place to go if you would have to leave your home, or a more distant place if you would have to leave your entire area. And you should know of some local shelters. You also want to determine how you're going to get there. So if you are going to be able to rely on public transportation, you'll want to know how to get in contact with them or what their policies are during disaster situations. Sometimes public transportation is available, sometimes it is not. Then you should have some kind of personal resources, whether that's a personal vehicle or someone you know who might have a vehicle that you can utilize. And then some private pay options. There are options around here for a service called Provide a Ride. You should always get in touch with them if you think you might have to use them in the future. Sometimes they require setting up an account, and then you can call and make arrangements. I know that there are some places where you can rent vans, and in that case, you should always know their numbers and how to get in touch and what their kind of policies are as far as how much notice they need and what they would do in an emergency. And then obviously there's ambulance services that sometimes can be utilized in emergencies, and then your local fire department and the EMS who can come and hopefully help in an emergency. Finally, you want to be able to start preparing your home. So you want to make sure your smoke detectors and your carbon monoxide detectors work. Make sure there's a fire extinguisher and you know where it is. Make sure your home is kind of decluttered. So if the power goes out and you have to get around in the dark, or someone has to come in and help get you out, that they can get through. And then it's good to know where your utility shutoffs are and how to shut them off, or how to instruct someone to shut them off. So if they need some basic tools, those should be readily available. The next thing you want to consider is who will help you. So that's going to be gathering, like I said, the contact info of like your local emergency response people. So, here I have called the fire department that I know serves my area and spoken to them, introduced myself, told them my situation. So they know, that I'm in a power wheelchair, that I have a service animal. And so if there were an emergency, they'd already know. You want to know the closest hospital to go to and probably have a backup just in case. So it's all about gathering up all this information. And then you're going to create something called a personal support network, which is a group of people who can assist you, not just at the time of the disaster, but also helping you research all of this information that we've been talking about, helping you gather up all of your documents that we're going to talk about, helping you keep all this stuff updated, and then knowing your emergency information and your medical information, helping you gather your emergency kits, and helping with any other disaster items that might, you might need assistance doing. You want to also know that these people are potentially going to be able to help you when disaster hits. So it's always good to have a minimum of 3 people, so you can divide up this work. I mean, somebody might be great at helping you get all of your emergency kits together and keeping them, updated and everything. And somebody else might be really good at being able to come and check on you at different times if there's an emergency. Somebody else might be, the person that you're going to rely on for transportation. And, consider family and friends, neighbors, coworkers, because you want to consider how you're going to handle yourself in a disaster if you happen to be at your place of business during a disaster, and also your service providers. So your aides and your nurses, they are definitely good people to have part of your network. We always recommend that you keep this support network like formalize. So, right, get a piece, have on a piece of paper the names of some of your 3-4 people who are going to help you, their contact information, so their phone number, or if you get in touch with them through social media, however you do it, and then who these people are, because if for some reason you were incapacitated, this document can also serve as a contact list for a emergency service provider to be able to connect with people they know that is in your support network. So when you're thinking about these people, you want to think like, who would I contact first or second or third? How would I contact them? Is it going to be calling or texting or emailing? How often would you want somebody to contact you if you're stranded in your home? How often would you want to contact them? So if they don't hear from you in a day, would they think that's strange? Or if they don't hear from you in 6 hours? All these things you should kind of think about and then discuss with the people in your network. Who will have access to your home? So are you going to give them keys to your home, your security code information? And then, if you have to evacuate, where are you going to go first, second, and third? And these people on your support network, are they, people who you're going to go to? And if not, are they going to know where you're going? And then you want to think about who can best advocate for you. Even if they're not someone who can come and be right by your side, maybe they're the person that, understands your medications the most, or maybe it's the nurse who's been seeing you for years. Maybe she can't get to you per se, but she knows your medical condition best. So she is a point of contact that you'd meet on there. And then who are you going to trust with important papers? So all of those thoughts need to go into who's going to go on your personal support network. And then your last pre-planning strategy is really to create your financial first aid kit. So you want to make sure that you have copies of documents that are important. You don't want to just hope that you grab your wallet and it has everything in it. It's always good to have a copy of your driver's license or your identification, your social security card and your passport, so that if you don't bring those with you directly or they're not all together, you have copies all in one place. This would include things like your insurance and prescription cards, insurance policies. So, if you have homeowners insurance or rental insurance, your car insurance, anything that you might need to get to if you had to vacate your home and you were gone for an extended period of time. Your mortgage and rental agreement, if you have a living will or any other kinds of wills or trusts, definitely if you have power of attorney, medical power of attorney, do not resuscitate order, any of your banking information, investment information, and then copies of credit cards. And FEMA has something they call their Emergency Financial First Aid Kit, or EFAC. And it is much more detailed, but it's a really good way to gather all this information together and to have it. There's ways you can upload it. There's checklists that you can go through to really help you with this financial first aid kit portion. Okay, so now you've done, believe it or not, just the pre-planning. And now you're going to kind of assess what your needs are. And so we recommend that you just kind of do a personal assessment. And what you want to do is think about what you're able to do for yourself. Like today, what you can do for yourself, set up in your home or set up in your place of business, when you have everything in place that you need. And then you have to think about what kind of assistance you would need during a disaster. If all of your assistive technology was not there for you, or your typical aides and nurses weren't there for you, what kind of assistance would you need from others during a disaster? And then you want to kind of list those personal needs and what other resources you're going to need to be able to take care of yourself in an emergency. So let me just show you an example. This is an example of a personal assessment page, and this is under the idea of evacuating. So it's broken down into 3 sections: building evacuation, building exits, and getting help. And it's got 2 columns, and the columns say my capabilities today and the assistance I need because of a disaster. So for building evacuation, for example, do you need help to leave your home or office? So today, with no disaster, if I were to try to leave my house, I can exit through 2 doors that have automatic door openers that are at opposite ends of my home. I can, one leads to a ramp that doesn't require any assistance. One leads to an electric lift that might require assistance with someone unfolding a lift or moving cars in the garage for me to get through. And then I do have an other door that isn't automatic that I can exit so long as it's not blocked or locked. So that's what I can do today. If there was a disaster, and for example, the automatic door openers stopped working or they became blocked, I would need personal assistance to have someone be able to open up the automatic doors that lead to my ramp, or open up the automatic door that leads to the lift in my garage, or potentially open up the door in my master bedroom if it were also blocked. So you would kind of work through this personal assessment. On this sheet, again, I'd think about my exits. I'd think about, how I would get help. So how would I call for help? Today, if just in general, if I needed help, I could talk with someone who was here with me. I could use my cell phone with my Bluetooth. I could do FaceTime through an iPad. And I also have an emergency call system that I could utilize. If there was a disaster, I'd potentially be able to utilize all those things unless there had been potentially like a power outage and some or all of them were no longer functioning. So you want to really take the time to go through all those areas, not just the evacuating, but also things like my personal care, my toileting, my bathing, how I get in and out of bed, how I get in and out of a wheelchair if I use one, how I access any of my personal assistive devices, what I need for feeding, what I need for grooming, all of those things, that thinking about how you do it today and then how you would have to do it in a disaster, whether that means your home, you're sheltering in place in your home with limited resources, or if you were to have to vacate your home and go to maybe a family member's that doesn't have the same amount of resources, or if you would have to go to a shelter that would definitely have decreased amount of resources. After you've done your personal assessment, Now you're ready to kind of think about creating your disaster plan. So your disaster plan is going to include a bunch of the pre-planning work that you've done and a bunch of the planning work that is to come. So you want to have gathered up your copies of your important documents, your personal assessment document that you've gone through. And with the personal assessment, I stress thinking about it, but I should have also stressed that it's a really good idea to write it all down. And the reason is because if for some reason you became more incapacitated, where maybe you couldn't communicate as fully to the people around you, or you felt like the people around you couldn't understand your needs, or they weren't giving you enough time to adequately express your needs, having written down in an assessment, like, hey, when I'm at home, I have a Hoyer lift that gets me in and out of my bed. And then you're trying to explain to someone, you know, at a shelter that you use this lift and they don't know what you're talking about. And they just want to pick you up and toss you on a cot. If you have it written down, sometimes you can hand people a document and that can help facilitate a deeper understanding of what you're trying to explain. So you want to have the copy of your important documents, this copy of your personal assessment, the copy of your personal support network communication plan, all consolidated together. And again, I recommend getting, you know, a series of Ziploc bags or other waterproof bags that you can keep all of this paperwork in. I have mine doubled up in a couple bags and, you know, tucked inside one of my emergency kits. And now we're going to go through the next steps, which are the planning steps, which is, you know, kind of just determining your evacuation plan, writing down instructions for rescue personnel, creating medical information lists, and then creating your disaster supply kits. So this is an example of an evacuation plan. This is my house. So I just had somebody draw out basic layout of my house and the different rooms. And then we drew a series of arrows of how you'd get out of each space to the closest exit. And it may sound silly, but when there is an emergency, and if you then have to rely on other people that aren't familiar with your home, aren't familiar with you, the more things you have to help communicate, the better. So, you know, I kind of drew a series of arrows from each room in my house to the closest exits, the most realistic exits, and then, you know, what those exits look like as far as the exit at the very top goes to my deck where I have a ramp. The exit through my front door goes out to stairs. Well, I couldn't in my wheelchair get down the stairs, but rescue personnel might be able to get me off the stairs quickest that way. So all of these things you should consider. And then I marked, you see these little letters, F and T and E. F would stand for fire. So if there were a fire, the easiest path of travel for me out of the home, unassisted, in a fire would be out through my deck, off the ramp, and away from my home. And then in my master bathroom, there's a little T and an E. So those would be the areas where it would make the most sense to go during a tornado or an earthquake. They are interior spaces in my house where it would be the most secure. And it's good to mark those down so that I know, so that other people would know, and so that my family would know, okay, if there's a, an earthquake or a tornado, and then rescue personnel are coming to my house, this is where, rescue personnel should look for me. You also, when you're thinking about your evacuation plan, you want to think about an outside meeting place. So when you're evacuating your house, if I go out the ramp and everybody else goes out the front door, where are we going to meet? We're going to meet at the neighbor's driveway, or we're going to meet at the house behind us. Or then you want to consider a safe place farther from your home. So, my safe place that's about 8 minutes away would be going to my sister's house. Or a safe place even further. So if we were to have to evacuate all of Medina County, where would I go? Or all of Northeastern Ohio, where would I go? And then you also want to remind yourself that at this safe place that you're talking about going to, if you have the capabilities to keep supplies and equipment there, so that if, for example, you are someone who utilizes a wheelchair and they have to evacuate you from your home and not take your chair, when you get to your safe place, is there another mobility device there for you to use? If I have to stay there for an extended period of time, my sister's house doesn't have a ceiling mounted Hoyer lift. So, if I have a transfer board there, at least I know there will be ways for me in and out of my chair. Any extra medical supplies, any extra medications that you can keep at this safe place is also a good idea. And then you need to consider if you are going to need to shelter in place. So sheltering in place means staying in your current location to avoid whatever uncertainty is outside. You might stay there by choice. You may not physically be able to leave. You might have to seal a room from outdoor toxins. You have to remind yourself that your personal support network might not be able to get to you while you're sheltering in place. And you might experience interruptions to your home care providers, your medical supplies, prescriptions, your utilities, any transportation. And in that case, you need to make sure you're ready to rely on your disaster kits. So sheltering in place, you want to think about during an earthquake, obviously, they use the phrase drop, cover, and hold on. So if there's an earthquake, you want to immediately go to a spot or get in a spot where you can be covered. You don't want to be near a window, near heavy bookcases that could fall down, and hopefully somewhere where you can brace yourself. During a tornado, you're going to go to the lowest level of the home if you can access it, or to a small interior room. That's why I would go to my master bathroom and stay away from doors and windows. I liked this phrase during a thunderstorm: when thunder roars, go indoors. I grew up sitting outside watching the thunderstorms, jumping in puddles. I guess we don't want to do that anymore. And if you're in an area where you get flooding, you want to know that your home has things like a working sump pump. And then if you do experience flooding, it's always good to photograph, especially for insurance purposes. During snowstorms, a lot of this is common sense, but stay inside, dress warm, be prepared for power outages. If there is a power outage, don't open your refrigerator or freezer if you can avoid it. Don't use your gas stove for heat. and disconnect appliances if it's an extended power outage. And then I put this for something like an active shooter. There are areas where this, you may live in an area where this is never, probably it's farthest thing from your thoughts, or areas around Cleveland where it is something that we have to consider. But you do want to have your doors and windows locked. You want to silence your electronics, find an out of sight place to hide. It's recommended that we don't hide in groups. And you wait until you hear from a first responder that it's clear. Oh. Let's see here. Sheltering in place during COVID. A lot of us know this because we've done it, but you want to stay home as much as possible. Wear masks indoors, stuff we've already talked about. But if you have to shelter in place because the COVID threat has gone up, you want to make sure visitors especially are reduced to just essential people. And that you have the right to ask visitors to wear masks in your home, to wash their hands when they enter, to leave their shoes outside, to wear gloves when they touch you or food. And if they are feeling sick, you have the right to ask them to not come in. You want to still consider always disinfecting commonly touched surfaces. And it's really important to have backup plans, which I think a lot of us already know because there is a caregiver shortage, so backup plans are important for that anyway. But, if somebody has to cancel for a single shift because they get sick or you're sick or, we're just told to stay at home again, you should try to have a plan in place, and stocking up on, non-perishable foods and toiletries is always a good idea. And then even if we're told to shelter in place, don't let that override your need for medical attention if you experience any kind of COVID symptoms or any kind of health symptoms that need to be looked at by a doctor. So then you have to think about, if you're not going to shelter in place, if you're going to evacuate. This would be seeking shelter outside of a hazardous area away from your primary residence. Hopefully you can first and foremost relocate to a family and friends residence, or you might have to go to a hotel or a mass care shelter. You may have to go a great distance. For example, if people in Florida, when they have to escape hurricanes, they have to consider evacuating a great distance. You have to think about if it's going to be short-term or long-term. You might not have a lot of access to your care providers or your supplies or prescriptions. And you may have to leave behind things like your supplies, your equipment, God forbid, pets. But you always need to have your disaster kits ready. And then just to have some idea of the minimum requirements that mass care shelters are supposed to uphold. There should be accessible parking. There should be accessible pathways and entrances. There should be an accessible route all the way from parking to the check-in, through the sleeping areas, eating areas, toileting areas, all the other activity areas. There should be at least one accessible toilet. For larger shelters, there should be one accessible bathing facility. They should be able to provide they should have backup power, so if you have medication that needs refrigerated, if you have medical devices that need charging, you should be able to do those. Red Cross shelters do allow service animals. That is not necessarily true for pets, but it is also a good reason to be in touch with potential shelter areas before you would need to go, to know what kind of things they provide. Okay, then it is also recommended that you write up some kind of instructions for your rescue personnel. So I have a tag that is on one of my disaster kits, and I used to have one that hung from my wheelchair. It gets ripped off, so I always have to check, but it says something basic like this. My name is Maria. I have a spinal cord injury and a T-tube. I use a power wheelchair. And then I describe very briefly how to turn it on to drive it. I have a service dog named Bronson. Please bring my medications, my supply bag, my chair charger from my room, and Bronson's food and medications from the kitchen. All that's written down so that if something were to happen, say I got knocked on the head and I was dizzy and I wasn't alert, rescue personnel could come in, know my basic needs, know how to help me, and know what I need to get out of there. There are also items called vials of life that you can get. A lot of times your fire department has them. You can download them online. And it's a document that will contain a lot of your information like that's written here, a lot more detailed information about your medications. And believe it or not, these are commonly kept on your refrigerator. Some people keep them in their freezer. Rescue personnel are trained to look for them in those locations first. So that can have information for them that would be necessary to help you. It's always a good idea to have your medical information written down. I have a sheet that kind of tells everything from my insurance information to my allergies, emergency contacts, my doctors, my hospital preferences, my pharmacy name, what kind of typical immunizations I've had most recently, and then additional information. So it's just a quick glance. It also says if I have a living will or a DNR. That way rescue personnel could have something like this, or I could take this with me, have it on me if I got taken to the hospital and I couldn't communicate enough on my own. Somebody could read this and find out what I need. It also, I keep a list of medications. It's recommended that you have at least 7 days of medications on you. Sometimes you can get pharmacies to provide extra, pills. Sometimes you can set aside a pill a month. Sometimes your doctor's office will have samples that you can obtain. Drug companies sometimes will provide you with samples so that you can build up a supply. You always want to know how to store your medications and what their shelf life is so that you're constantly circulating your extra medications and they don't end up being years old. And then always talk to your doctor to see if you can have extra refills on hand, whether you have them in paper format or if you have them in an online version, if you were to have to go to a different pharmacy. And then the last thing you need are your supply kits. And you're going to see, I'm going to recommend 4 disaster kits. And although I recommend 4 different ones, a lot of them overlap. So your basic supply kit would be the thing that you're going to have in your house. It's going to have a first aid kit, flashlights, a basic toolkit, stuff like duct tape and maybe a battery powered radio, various kinds of batteries. Those can be, your AA's, your AAA's, your D's, whatever, but also backup batteries for your devices, extra chargers, charger cords, stock up on your toiletries, on antibacterial items, a 7-day supply of food and water, non-perishable food and water, a manual can opener, rain and snow gear, clothes and blankets. Obviously, this all doesn't have to be stockpiled in one place, but just knowing that you have it and where it is and that you can point someone to it kind of suffices. Lots of water-resistant plastic bags, candles and matches in a location that you can get to, cash, coins, and keys. We don't often always work in cash and coins, but you know, if power is out and you have to go somewhere, your credit card may and your Apple Pay may not be doing anything for you. Actual keys to your home if your, you know, alarm system isn't working. Again, utility shut off information, and then whistles, flags, and flares. And then some of this kind of translates into your car kit, and you can have, or into a portable kit, the first aid kit, the flashlights, the tool kit. A lot of the things that are in your basic supply kit, you can keep in a consolidated portable kit, and then you can just grab it to take with you, or you can have a separate one that is actually in your car or whatever transportation you utilize most. Then you should have your personal supply kit. And this is where all of those documents that you've collected would be put in a waterproof bag, along with your extra prescriptions, any medical info, your medication lists, and then your potentially a 7-day supply of medications. If you're someone who keeps pill containers filled, it's good to make sure those, you know, are filled, especially around this time of year. I try to keep mine filled. I don't wait till the bitter end if I can help it. You know, any medical equipment that you might need that you can take with you, extra batteries for hearing aids or for oxygenators or implants if you use them, a 7-day supply of medical supplies, kind of all consolidated in a bag, anything like a blood pressure cuff or a glucose meter if you utilize those. If you use any kind of eating or drinking aids, if you have an extra that you can keep in a bag, communication aids, you know, pointers or whatnot. And then any mobility aids that you might need to take with you, whether they're smaller things you can pack in a bag or things you can just keep consolidated close together. And then finally, your pet or your service animal kit. You want to have their dog license and tags, and this can be copies also, a recent photo in case you would get separated, or if they would need to go to a vet and somebody else would need to go to the vet for you, their vaccination record, their vet information, medications if they take them, food and water for them, leashes and collars, treats and toys, blankets and bedding. And then I have a little first aid kit that I keep for them with alcohol and ointment and gauze and tape and Benadryl. And so, you know, you want to do this so you can maintain your independence, you can minimize your stress, you can avoid injury, you can assist emergency personnel, you can prevent involuntary institutionalizations, and mostly you want to be prepared because emergencies and disasters will impact your independence, but they don't have to impact your human and civil rights and your dignity. And then this is just a list of national resources that will be part of this presentation, so you'll have them. And so I know we are at the 8 o'clock mark. So if there are any questions, I'm happy to take them now if we have a minute or two, or you are more than welcome to send them on to Megan, or my contact information is here. you can call or email me, and I'm happy to get connected with you and let you know more.
Yeah, thank you, Maria. If you have any questions for Maria, feel free to put them in the chat and I'm happy to read them aloud. If you want to unmute yourself and ask, feel free to do that as well. We can hold like a minute or two if anybody has any questions. While everybody, oh, go ahead.
I was going to say, Megan, I don't know. I can get you some of the documents that I showed, the personal assessment and like the personal support network document. If you have a way to kind of post those, or if anyone's interested, they can contact you to get them if you'd like.
That would be amazing. Yes, we can definitely get those out there. And if anybody is still thinking of questions, we will have this recording uploaded to our YouTube channel, posted on our Facebook page, and then that link posted on our Facebook page and our website, as well as an email blast coming out by the end of the week. So it will be available for reviewing. You will be able to share it with anybody that you feel would benefit from hearing this or would be interested. I will show, we do have emergency preparedness kits. I know I've mentioned them a lot. So here is a picture of what it is. It's just a starter kit, something to just get you started. So along with the documents that Maria will get to us, it also comes with another template of some sort to help you start thinking about what resources and contact information, medications, things like that to list down. But it comes with a little Swiss Army knife, a flashlight with like the different screwdriver heads that you can attach to the flashlight to turn it into a screwdriver, a little 7-day pill case, a poncho, trash bag, zip ties, a little travel razor, things like that. So if you've not received one and you live within 50 miles of downtown Cleveland or willing to come to the Old Brooklyn campus of Metro Health, we would love to get you one of those. Okay, so with that, we will conclude our evening, but Maria, thank you so much again. That was a lot of information, a lot of great tips. And I really liked how you had 4 different types of kits. I loved it. I'll be thinking about putting together my kit soon. But everybody, thank you all for coming. Like I said, we will be sending out this replay by the end of the week. Hopefully the transcription will come with that. If you guys have any questions, need link to resources or anything like that, reach out to us. Our email is unitedspinalneo@gmail.com. We would love to help you with whatever you need. So thank you all for coming and have a wonderful evening.
Thanks, Megan.
Stop recording.